9 infants died at Johannesburg's Rahima Mooosa Hospital. Now, the incident follows a bacteria outbreak. According to the hospital's acting CEO, that's DR Frew Benson, investigations are being conducted but could not determine the cause of the outbreak. He says they have now increased control measures at the facility. Benson says an investigation for NEC, which is necrotizing enterocolitis, is an inflammation of the bowel, especially in premature babies, adding that they did not find any intact cause for the outbreak. The fact that for about 43 babies over the period of a few months, 9 of them demised. Benson says the hospital has strengthened infection control measures implemented. Well, to talk more about the infant deaths at the Rahima Mooosa Hospital, we're joined on the line by DR Frew Benson. He's the acting CEO at the Rahima Mooosa Hospital. Good afternoon, Dr. Benson. Thank you for your time on the SABC News Desk. Details are still a little bit sketchy, but can you tell us what led to the deaths of the 9 babies under your watch at Rahima Mooosa this month?
Yeah, as you explained, good afternoon and thank you for having me. As you explained, the outbreak was caused by necrotizing enterocolitis, or what we call NEC. This is a condition that causes inflammation of the lining of the stomach of a baby. And this predominantly occurs in premature babies.
Doctor, 9 deaths in 5 months, we understand, between March and July. When did you first start getting concerned, and when did investigations commence? One would think that after the very first case was reported, investigations would start and preventative measures would be put in place.
Well, as a hospital, we've got normal practices against infection. Now, that includes isolation of the infected babies and hand washing practices. But the cause of NEC is not effective. It's a multifactorial causes of the disease that sometimes can include infection. In this particular case, it was noted round about in April when the first couple of cases occurred. Then we noted that a cluster of cases occurred and the number of cases is more than known. At that point in time, we informed the NICD and an extensive investigation was conducted by a multi-sectoral team that included hospital personnel. This looked at environmental factors, because when there's NEC, you need to look for infective causes as well.
Doctor, just on that note, I'm not a medical expert, of course, but some of the possible causes of this bacteria is also the food that the babies, or the premature babies in this case, are being fed. And premature babies, we know, are often usually tube fed. Is it a possibility that these babies got sick from the instruments used or the food that is used while they were being fed?
First of all, it's not a bacteria. That's why we had to look for a cause. NEC is not a bacterium. It's a condition, and it's inflammation of the bowel. Factors that contribute to it is immaturity of the child. And as I said, when it's investigated through doing postmortems, organisms is also found that may have contributed to the inflammation of the bowel. But in terms of feeding, yes, you are right that, for instance, a child that is breastfed is less likely to develop NEC. And there are several reasons for that. But in terms of, we don't feed children through nasogastric feeding. What we promote in hospital is breastfeeding. That's the number one feeding mechanism that we promote. If a child cannot suck, and that is common with premature babies, that they are unable to suck. They obviously fed intravenously, and we promote breastfeeding with the child. So there's no nasogastric, as you indicated, feeding, and that's not one of the contributing factors.
Yes, go on, doctor. We're listening.
What practices in a hospital, when a child is in hospital, one of the common problems in all units, neonatal units, is hospital-acquired infection. And maybe that's where the confusion comes with Klebsiella and other hospital-acquired infections. When a child is in hospital, the chances of picking up drug-resistant bacteria and other organisms is very high. And that is a common problem in public institutions and private institutions throughout South Africa and throughout the world.
Dr. Benson, just fill us in on the preventative measures you have in place in the neonatal unit at this point.
Well, we've got area nursing. At the moment, we don't have any NEC case in the hospital. Let me say that. The last case we had was in July. But we've got barrier nursing in place. We've got hand washing. And then between patients, all clinicians are encouraged to make certain that they use antiseptic hand rub
Dr. Frew Benson. Dr. Frew Benson, the acting CEO at the Rahima Mooosa Hospital, thank you for joining us on the line there this afternoon. Well, time to take a short break. I'll be back with sports news after this.